Type 1 diabetes, or T1D, is an autoimmune disease where insulin-producing beta cells in the pancreas are mistakenly destroyed by the body's immune system. As a result, people with type 1 diabetes need to take insulin to survive. Type 1 diabetes diagnoses occur in both children and adults, and there is currently no cure. Researchers have uncovered some factors that may increase a person's risk of developing the condition, such as having a sibling, parent, or child with type 1 diabetes. However, nearly 85% of diagnoses occur in people who have no family members with the disease. And a definitive environmental trigger for type 1 diabetes has not yet been found. So, how do you know if you're likely to get type 1 diabetes? Screening. Thanks to advances in research and a better understanding of the human immune system, we are now able to detect type 1 diabetes early, often months and even many years before symptoms appear. Screening is a simple blood test done through a research study or at a laboratory recommended by your doctor that detects proteins in the blood called autoantibodies. These autoantibodies indicate that the body's immune system is attacking the insulin-producing cells in the pancreas. If a person has 2 or more confirmed and persistent autoantibodies, they are in an early stage of type 1 diabetes. People with first-degree relatives with type 1 diabetes should strongly consider screening because they are more likely to develop it. However, most people diagnosed with type 1 diabetes do not have a family member with the condition. That's why we're working towards universal screening for everyone. Why? Because screening allows us to detect type 1 diabetes in its earliest stages, even before symptoms begin. This can protect people from experiencing a serious complication that often comes with a type 1 diabetes diagnosis: diabetic ketoacidosis, or DKA, which is life-threatening. Detecting type 1 diabetes early through screening also means you may be eligible for research studies to help us understand how to delay and ultimately prevent the onset of type 1 diabetes. And you may be eligible for an FDA-approved therapy that can delay the onset of clinical or stage 3 type 1 diabetes, which is when insulin is required. Without screening, breakthrough disease-modifying therapies like this wouldn't exist today. Screening is a critical component of type 1 diabetes research. By identifying more people who are in the early stages of type 1 diabetes, researchers can learn more about the progression of the disease and contribute to research that aims to delay, reverse, and ultimately prevent it from occurring. But if people don't get screened, type 1 diabetes research could potentially stall, slowing the incredible progress we have made in recent years, not only in delay and prevention, but in advancing tools and technologies that improve and save lives every day. By getting screened for type 1 diabetes, you're not only looking out for your own health, you're also putting us on the path to better health outcomes for everyone. Learn more about how to get screened at breakthrough-t1d.org/early detection.